Hello and welcome to Drugs Plus. Whether you're here for exam revision or just general interest, I hope you find this video useful. If you do, please give it a thumbs up and subscribe to support this channel so that I'm able to continue creating this content. This video is about the pharmacological treatments for heart failure. Heart failure is a condition whereby the heart is unable to pump sufficient blood around the body in order to adequately perfuse tissues with oxygen. Among other symptoms, this can cause muscle fatigue and peripheral edema and is one of the leading causes of morbidity in the UK. For a more detailed description of the condition itself, you can see my dedicated video, the link for which I'll provide below. Phenodilators are drugs which cause a reduction in central venous pressure, which in turn reduces left ventricular end diastolic pressure, preventing adverse remodeling and edema. Most of the most commonly used phenodilators are prodrugs for nitric oxide. Nitric oxide moves into capacitance veins where it activates guanylyl cyclase to produce cGMP. This activates protein kinase G, which activates myosin phosphatase, the enzyme which prevents actin-myosin crosslinks from forming in smooth muscle cells, thus causing venodilation. Drugs in this class include nitroprusside and GTN. Another class of drug used for the treatment of heart failure is diuretics. These drugs increase the amount of water excreted into the urine and therefore reduce blood volume. The reduced blood volume results in a reduction in left ventricular end diastolic pressure, which prevents adverse remodeling and edema. Drugs in this class include furosemide. The next class of drug I'm going to discuss are the ACE inhibitors. ACE, or angiotensin converting enzyme, converts angiotensin 1 to angiotensin 2, which activates angiotensin receptors on vascular smooth muscle cells. These are GQ coupled, meaning their activation results in an increase in intracellular calcium. For more information on G protein coupled receptors, you can see my dedicated video, the link for which I'll provide below. This calcium increase causes the vascular smooth muscles to contract, leading to vasoconstriction. ACE inhibitors, as their name suggests, inhibit ACE, meaning angiotensin 1 is not converted to angiotensin 2 and its downstream effects do not occur. This results in vasodilation, relieving the pressure at which the heart must pump against, and therefore relieving the symptoms of heart failure. Drugs in this class include captopril and ramipril. Similarly, angiotensin receptor blockers, or ARBs, prevent angiotensin 2 from activating its receptor, and therefore the same downstream effects are halted, again resulting in vasodilatation. Drugs in this class include candesartan. Next, beta-1 antagonist, more commonly known as beta blockers. Beta-1 adrenoceptors are the cardiac receptors to the sympathetic nervous system. During the fight or flight mode, the sympathetic nervous system releases adrenaline and noradrenaline, which bind to these receptors, causing the heart to increase in chronotropy and inotropy. However, beta blockers can be used to decrease both of these, which has the effect of increasing the time during which the heart fills with blood, diastole, thus increasing cardiac output and relieving the symptoms of heart failure. Drugs in this class include propranolol, metoprolol, and bisoprolol. The final treatments for heart failure are the positive inotropes, which I'll be discussing in next week's video. Thank you for watching this video. If you found it useful, please give it a thumbs up and subscribe to support this channel so I'm able to continue creating this content. I'll be back with more videos soon.